My name is Nhien. I'm a second-generation Vietnamese American. My parents are refugees from Vietnam. I was born in Texas, grew up in the Midwest, and currently reside in California. I've come to understand that the different aspects of my identity as an Asian American are tied to my experiences growing up in different parts of the United States. I'm curious about the different intersectionalities that influence our Asian American, Native Hawaiian, and Pacific Islander communities. We are as diverse geographically as we are ethnically and culturally, from the Pacific Northwest to the Northeast, from California to Texas. I'll be traveling to different cities and states all across the nation to highlight the stories and challenges that make up our unique diaspora and also what brings our communities together. New York City, the Big Apple. Over 1 million Asian Americans call New York City home, representing a multitude of different Asian American, Native Hawaiian, and Pacific Islander ethnicities. I'm staying in Koreatown during my trip. The Korean community is one of the largest Asian ethnic groups in the city, with a large presence in Manhattan and specifically in Queens. I made my way over to Flushing to visit a Korean market where staff members from the Korean Community Services, a nonprofit organization dedicated to serving the Korean American community in New York, were handing out free PPE supplies to the public. My friend Uni Cho, Senior Program Manager at KCS, was there helping to work the stand at the market. After spending time in Flushing, I hopped into an Uber and went over to the KCS main office in the Bayside neighborhood of Queens. There, I caught up with Jessica Lee, Program Manager of the Healthcare Navigator program at KCS. I asked Jessica to tell me more about the history of KCS and the challenges that their community members face.
KCS was founded in 1973. We're one of the oldest and largest nonprofit organizations that serve the Korean immigrant and Korean American community in the greater New York City area. The challenges I've seen personally, I think, is we've seen a growing number of older folks, so Korean immigrants who are over 65 years old, who come to, take care of their grandchildren. And so those folks, if they don't have eligible immigration status, they can't apply for health insurance, and so they can't seek care at an affordable cost. But that age group has a higher chance of being diagnosed with a certain chronic disease, so they can't access the care, affordable care. It's been difficult to find health care or health services at a cost that they can pay for without being a burden to their own children.
Learning more about the senior population that KCS serves, I traveled back to Manhattan, where I was invited to attend the kickoff event for KCS's new adult center in Upper Manhattan. I spoke with Helen An, the director of KCS Older Adult Centers, who told me more about the significance of today's event.
Today is the very meaningful and exciting day for KCS. After 20 years of second older adult centers in Flushing, this is our third older adult center. We were awarded to open this new Manhattan older adult services, and today is the kickoff day. So we are going to celebrate today's opening. During the pandemic, many Korean American seniors living in Manhattan and not in Queens, they actually suffer from food insecurity, isolation, and a lot of anxiety due to the pandemic. And during the pandemic, with a special grant and special sponsor, we were able to deliver meals in Manhattan. My hope and my goal that many seniors use these services, and we want to expand more services and more days. So hopefully we can have full older adult center located in Manhattan, so we can accommodate all the nutrition program, case assistance, education, recreation, etc. We want to have lots of programs and also provide health services here.
When the kickoff event was over, I made a short trip down to Lower Manhattan to visit the office of the Coalition for Asian American Children and Families, CACF for short, the nation's only Pan-Asian children and families advocacy organization. I wanted to learn more about how the different policy issues affect not only the Korean American community, but all AA and NHPI communities when it comes to healthcare. So I sat down with Medha Ghosh, the health policy coordinator at CACF, to give me an overview.
I would say a major one is that we still have the model minority myth that is very harmful. It's not accurate present representation of our diverse community that faces a lot of different needs. The model minority myth assumes that we are actually better off than a lot of other marginalized communities, that we are economically and just overall in a more positive place. But actually, we do face a lot of different issues where we're very much navigating the fact that, like in New York City, for example, the APIAHF community are twice unlikely to be uninsured as our white counterparts. And then we are also facing overall, as the Asian American Pacific Islander community in New York City, with highest rates of poverty. So these are things that go overlooked because there isn't really that much, first of all, data that acknowledges our issues, breaks up, data disaggregation is super important to us because it recognizes that there are so many different communities that make up our population and their needs need to be recognized.
It doesn't need to be said, but New York City is truly a microcosm that reflects all of the different racial and ethnic identities that make up our country. There are millions of people in New York and millions of stories. I'm grateful to have spotlighted a couple of them while I was here. All of the community-based organizations I visited are a part of the Asian and Pacific Islander American Health Forum's National Partner Network. Highlighting their work and talking about the challenges our communities face is instrumental in advocating for and improving the health of our AA and NHPI communities. To learn more about our work, visit our website at apiahf.org.